Hi, I'll say a few words about our work on gradient tones. The context of our work is adaptive rigid body motion correction, which relies on a signal from an external marker in order to infer the rigid body transformation of the current head pose and head position in a reference time point. Optical methods can do that. They essentially track a marker with a camera, and the marker is attached to the forehead of a subject, for instance, and the camera is typically placed in the bore. Alternatively, you can also use NMR markers or NMR field probes to do that job. Such field probes consist of an NMR sample and a small coil, RF coil, that's tightly wound around it. The main benefit of optical methods is their straightforward separation between the tracking experiment and the imaging experiment. Since NMR-based methods rely on the same modality as the MR imaging experiment, their separation requires some more consideration. Previously, NMR marker localization was achieved by applying a sequence of 3 static gradients and measure the marker's NMR frequency shift. This way of tracking NMR markers has several shortcomings that we addressed in this work. The insertion of a marker tracking module prolongs scan time and lower bounds the minimum sequence TR to the duration of this tracking module, which is longer than the repetition times in clinical sequences, and hence renders the method incompatible in such scenarios. Another shortcoming is its dependence on the local static B0 field at the probe position. Our approach does away with that by separating the tracking from the imaging task in the frequency domain. This allows the synchronous execution of marker probe tracking and other sequence tasks such as image encoding. Our method is also insensitive to static B0 fields at the probe's position because it relies on high frequency gradient oscillations rather than static gradients. The idea is to use a set of 3 different frequencies, one for each gradient direction, and play them out synchronously. This establishes a unique relationship between a frequency and a spatial dimension. The field probe's coordinate along one such dimension is then proportional to the magnitude of the measured frequency component in the probe's phase signal. The superposition of gradient tones and existing sequence gradients can be established in a straightforward way. You just add them. However, you first want to make sure that the tones are orthogonal to the waveforms, the sequence waveforms, which can be achieved by applying a band stop filter to the sequence gradients as illustrated here prior to inserting the tones. In this fashion, you can actually scale your sequence gradients in any way you want without affecting the probe localization. If you want to combine your tones with sequence gradients with unoccupied spectral bands, just insert your tones into those bands and no filtering is necessary. In any case, you obtain an orthogonal set of gradient waveforms for both sequence tasks and probe tracking. When you now go ahead and play out your tones, you observe that the unique relationship between frequency and direction is violated to a certain extent. You see, for instance, that the 6 kHz signal originally applied to the X gradient is also visible in the linear field components along the Y and the Z direction, as well as in the homogeneous field component. This behavior is largely linear and time invariant, which means that it's amenable for calibration. At the bottom left you can see a picture of the field probes we used in this work. They consist of a small fluorine-based NMR droplet, a glass cylinder, a microcoil and epoxy casing. The receive chain was connected to the spectrometer of a clinical MR system and they were excited with separate hardware. We developed our own hardware interface which consisted of separate excitation chains, preamplification stages, as well as pin diode switches for independent TR operation. We placed 4 such field probes onto a pair of standard MR headphones to perform our measurements that you can see on the top left. This allows us not only to do motion tracking but also perform concurrent field monitoring in the head frame of reference. On the right hand side you see the case-based sampling pattern in the moving reference frame without adaptive motion correction at the top and with tones-based sequence updates at the bottom. The additional benefit of concurrent field monitoring in the head frame is its ability to capture encoding perturbations from field drifts, physiological activity of the subject, or motion that occurred between the slice excitation and the imaging readout. Here are the gallery of imaging results. You can see in image B that field monitoring in the head frame can correct for in-plane motion, whereas this is not enough for through-plane motion, as you can see in image F. You need prospective motion correction to account for through-plane motion, as illustrated in image G. Images C, D, G and H illustrate the achievable image quality for a motion-corrected gradient echo sequence with subject motion that would have otherwise caused the image artifacts shown in images A and E.